Uh, Thank you so for the introduction. On this onset, I'd like to thank ZEISS and the AIOS for giving me this opportunity. So today I'm going to talk about ZEISS EQ Markerless Workflow cataract suit. Now, all of us keep thriving to be efficient, to save time, and indirectly save cost. But what is efficiency? Efficiency is doing something better what is already being done. So let's look at what is already being done. We have been using these markers for quite some time, but errors happen because there's no reference point. Errors happen because of the head tilt, cycle torsion. Sometimes when you excessively wash the cornea, the marks go away. As you know, every 1 degree of misalignment of the toric lens, we lose about 3% of its corrective effectiveness. And when we use the three-step technique of manual marking, which is the first marking is done at the 0180 at the slit lamp, then intraoperatively it is done at the 0180, and also the marking is done at the intended axis where the lens has to be aligned. Now, when we do this three-step procedure with the bubble marker, has been found a mean error of axis about 2.48 and a total error of toric alignment about 4.9. Now, this is where the Callisto comes into picture. Now, this is nothing but a markerless system, and which gives you an intraoperative, overlay in the microscope itself by taking the data from the limbal vessels, which is acquired during the acquisition of IOL Master. Definitely, I think in terms of a full package machine, IOL Master is the machine to go for. You have everything from formulas to where you can wirelessly transfer your data and so on and so forth. But moving forward, this has a lot of features from creating the intended incisions from, let's say, if you want to plan your incisions from your main ports to side ports to correcting of your astigmatism, from ARC, OC side, whatever it is, you can enter the data. Once you've entered, you're rest assured this gets wirelessly transferred to your OT, and you get an overlay compensating the cycle torsion. Now, you can also do your capsular axis, which will be perfectly centered, and you can decide what size you want to, and which is extremely crucial, especially when you're doing a toric or a trifocal lens. Now, obviously, you can align your toric lens too. All my toric patients, I always use a CTR. As you can see here, I implant it under irrigation. Once I've implanted the trailing part of the CTR, I hold it with a microforceps and place it into the bag. With this, I'm rest assured that by mistake also the CTR doesn't slip into the sulcus. Now, why CTR in all my patients? As you can see in this is an immediate post-op OCT, where you can see a huge gap between the posterior capsule and the lens. This is one of the reasons why there is a higher chance of rotation during the early post-operative period. But when we implant a CTR, what happens is basically we expand the bag, bring the anterior posterior capsule together, closer together, that way increasing the contact between the capsule and the lens. Here you can see post-implantation of the CTR, there's a beautiful contact between the posterior capsule and the lens, and this prevents from the rotation during the early phase. It also has an eye tracking, so if at all the patient moves his eyes, you do not need to worry. This is how it looks like, where the markings on the lens, you need to perfectly align with the three-line overlay, which you can see through the microscope. Now, what's the difference between manual marking and markerless system? Actually, quantity of vision, absolutely no difference, but quality of vision, there is a significant difference, especially if you're using a toric trifocal lens. It makes a huge difference, not just when you test. In fact, the patient itself appreciates a huge difference in terms of quality. There are a lot of studies showing the same. Now, when you look at the evolution of microscopes, it started in the early 1920s. Then in the late 1920s, the binocular microscope came to picture. Then in the 2014, the modern day microscope came to picture. Are we actually progressing or regressing? This is where the 3D visualization system of ZEISS RTO comes into picture, where with the coming of the 3D visualization system, we have taken care of three people. First, the doctors, the second, the patients, and then the trainees. So let's look at the consultants first. Yeah, as you all know, I think it's been an occupational hazard where a lot of doctors, ophthalmic surgeons have a lot of issues with their neck and back. This is because of a constant operating or bending, abnormally while you're seeing in the slit lamp. So especially like you see in the image, when you're doing your training, you really struggle. And with the coming of the 3D system, you can just simply relax, sit back, and then, just operate without, bending or sitting in a very awkward position. Now, when we're looking at taking care of patients, how do we take care of patients in this? Since we started operating on the 3D system, we started using very low illumination. In fact, we did a study where we have shown there's a significant difference in illumination between a 3D system and the standard operating microscope. And as you all know, the lower the illumination, the patient is more comfortable. Eventually, the patient is more cooperative. And the surgeon also feels nice when he's operating with the patient because the patient is looking at the light. The next thing is trainees. Trainees have really, it's a boon to them. From the time it's come, the learning curve has completely shortened. And in terms of viewing, you don't need to limit yourself to one or two. There is n number of trainees can come. You just have to have a cheap 3D glasses and you wear it and you're good to go. And absolutely no discrimination between any trainees, be it a trainee who just joined or let's say he's the senior-most trainee. No matter who it is, from day one, he will be seeing through the 3D microscope, which is very important because the first thing of picking up your skills is, the depth perception. And that will definitely with the 3D system, it is, you're learning about depth perception from day one. Now we have all the best machines and the best hands. Is that enough? Absolutely not. All of this has to be connected and this should be a seamless one. This is where the ZEISS EQ Workplace comes into picture. Basically, what it does is it brings all the machines in your hospital all onto one platform, which is the EQ Workplace. And it does through a wireless platform called as a forum and connects everything. Now, let's look at what happens in the OPD. First, if a cataract patient comes, then we do the biometric measurements. This is wirelessly transferred into your through forum into your EQ Workplace. Now, not just the biometric data, your topography, 3D, OC, whatever it is, everything will be at your EQ Workplace. And this can be accessed from any computer, be it your office, or suddenly you can access it in your home, in your OT, wherever it is, you can access this data. Now, whenever you do login, first thing, once you need to do this is you need to personalize certain things. Let's say if you are you always use one particular formula or one particular IOL company or the quantity of order quantity and email. So once you enter these data, you don't need to keep repeating it again and again. Now the next thing is IOL calculation. Sorry. Okay, perfect. So coming to IOL calculation, one of the key features is everything gets auto-populated, and then you get options of the lens, and you can select the lens which is appropriate for you, and then just press the order button, and you're good to go. You can do your surgical planning in your office itself, and this will be wirelessly transferred to the OT in terms of your toric IOL placement, or OCCIs and so on and so forth. But let's say if one of those days you're not able to do it in your office, it got late, you're going home. If you have a long drive, you can do it on your phone itself and transfer all this data from your phone to the OR directly, or just review your other surgeons, what have they planned also, you can do it. That is a beautiful feature. Now, in the OR, let's say you have decided the lens, you have taken the package of the IOL, and you just need to scan the IOL, and this data is uploaded onto the EQ Workplace. Now, in the post-surgery visit, you can personalize the IOL consent. I feel this is a beautiful feature where you can, for each doctor or each IOL which is being used, you can really personalize the constant and really tighten your results. Now, all of this, does it really improve efficiency, or is it just a gimmick? So what we did is we did a study where we looked at toric IOL EQ Workplace before the EQ Workplace and after. So when we look at the before EQ Workplace, this is how the normal flow goes. And let's say time ranges from 8 minutes, 30 seconds to 62 minutes, 30 seconds. Now, after the EQ Workplace came into picture, so this is how this is the time we took. It took about 55 seconds to 1 minute. So almost, let's say the best time, let's take it before EQ Workplace, is about 8 minutes. So we save about 7 minutes, around 7 minutes per patient. Now, this is how the intraoperative flow normally goes, with and before and after the EQ workplace. Most of it is common, but there are two places where we save time, and we save about 7.5 minutes in the OR. That means for each patient. Normally, we operate about 100 and 150 surgeries per day. So that means we have saved about 750 minutes, which is a very significant time. And the same scenario is in the OR also. In the OPD also. Now, let's leave all of this and let's get into the patient's shoe. All of us want a patient flow don't want a patient flow to be long and inefficient. We want the patient flow to be short and sweet. Now, let's look at a toric workflow without EQ markerless workplace. Now, on the day of surgery, these toric patients usually local anesthesia is applied not just once, in fact twice, once at the slit lamp and then once just before you start the surgery. Now, as you know, the more number of times you apply the local anesthesia, it is pretty toxic to the epithelium, and this leads to punctate epithelial erosion. So this creates a lot of discomfort for the patient on the day of surgery, a lot of watering, redness, photophobia, and also decreased vision on the day of surgery. But when we look at a toric workflow with the EQ markerless workplace, there is absolutely no added step, for a toric patient as compared to a monofocal patient. The patient just simply comes in and goes out, and his overall experience is fantastic. He's so much more comfortable. His visual recovery is much faster. In fact, he's recovered his vision on the day of surgery itself. So I would like to conclude by saying we need to be efficient, not just at work. We need to be efficient in the rest of the time in our life. The smallest work that we do, just like, let's say brushing your teeth or wearing your dress, keep thinking of how efficiently you can do. That way, no matter what work you do, you'll be rest assured, efficiency happens at a subconscious level.